If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. Now, this is our 16th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line. That's 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into our discussion. Now, for this episode, we have Dr. Marguerite Kotsina, geriatric medicine attending at the New York Methodist Hospital. Next is Dr. Barbara Gatton, emergency physician at New York Methodist Hospital. And last but not least, Dr. Placido Morano, rheumatology attending at New York Methodist Hospital. And I want to welcome everybody to the show's 16th year, and I have a power-packed guest list here tonight. I mean, anybody that watches this show knows these three. Been brought back by popular demand, and we're looking forward to hearing what's going on in your lives, and we're going to get to the show. But we got a busy week in the news, so let's talk a little bit about the news. There was a pill discovered this week that you can actually lose weight without exercising. Sounds too good to be true. But actually, this is a new hormone that was just discovered by the name of irisin. Similar to insulin, this is irisin, I-R-I-S, from the Greek goddess messenger. And what it does is when you exercise, it sends a message from your muscle to the bloodstream to get the benefits of the exercise. That's how it works when you exercise. This pill tells the body that it fakes the body out, and it makes it believe it was exercising. And what it does is it changes bad fat to good fat, and there's such a thing as good fat. Good fat helps to break down glucose and other nutrients and help you to lose weight. So by getting this excess of the good fat, which usually we get when we're infants, this is the way this pill works. It's expected to be ready in about a 2 to 3 year period because it's naturally occurring. It works in mice. It's identical in mice to humans. So again, we have a little ways to go. Usually you don't get anything for nothing, but this could be a big breakthrough. Let's say you've got Parkinson's and you can't exercise, or you're quadriplegic, you can't exercise. You could still get the same benefits. And if you have a cancer that would benefit from exercise, which most do, like breast cancer, this might be another treatment. So it's kind of interesting. irisin, we'll keep an eye on it. Another study actually looked at pedestrians who were killed or injured while wearing headphones. I mean, how many times we see people going around with headphones on? It seems that if you're going to get killed, you're likely to be a male, you're likely to be under 30, and you're likely to live in an urban area. So it might pertain to a lot of people living here. And they're walking around, and what happens is that they're distracted. They're listening to this they're listening, and they walk right into the car. The number of cases has tripled in the last 10 years, number of deaths that have occurred. Again, if you're a male under 30, inattention blindness, it calls. You're blind to your atmosphere because you're so wrapped up in the music. Or multiple stimuli that you get where you hear the horn, but you also hear the music, and it throws you off guard. So it's just something I guess people better look out for, that these earphones that mask the sound of the train or the car horns, they can be very dangerous. You don't have to be driving a car to be distracted. Just be out on the street. So for those who have no people 30 or under, particularly, let them know. Be careful. Now, alcohol in pregnancy. I'll ask Dr. Gatton, how much alcohol is safe in pregnancy?
Right now, we're still saying zero.
Zero.
Because we don't know.
Zero. And a new study contributes more to that, showing that women who drank an occasional drink, not every day, had an occasional drink in the first trimester, put the newborn at risk. Every drink in the first trimester led to a possibility of decreased birth weight and decreased length. Now, Dr. Gatton shaking your head, no, this is one study that I'm presenting. But
I absolutely agree. No one should be drinking when they're pregnant.
Oh, okay. So remember, there's no safe drink. That every additional drink increased your risk of microcephaly, small head, by 25%. Wow. So this is not something that should be taken lightly. And I know my daughter was just pregnant, and I was saying, oh, why not take a drink? You're in the third trimester. You can afford to, and this study shows even in the third trimester, you shouldn't be having it. So if you're pregnant, put off the drink for a little bit of time, and I think everybody will be happy about that. Women have there's no safe level to drink. Lose weight without exercising, we talked about. Now what about if you have bypass surgery in the stomach, where you actually cut off part of the stomach, make it much smaller, and then hook it up to the intestine. There's that surgery, and then the surgery we actually put a band around the stomach to make it smaller. The lap band is reversible. The bypass surgery is not reversible. Which is better?
The band, probably.
I think it depends on the patient.
Depends on the patient, but in 10 years, there were much more complications with the band. Had to be replaced, didn't have the same benefit of weight loss as the bypass. So the recommendation now for weight loss, for diabetic control and so on, is to go with the bypass.
I see some bypass and they have arthritic problems.
Right. Why is that?
That's poorly understood, but I see that.
So it's interesting. So if you're thinking of going for weight loss surgery, bypass is clearly the most effective at losing weight, and that's what you want to stick to. We have one more story. Oh, this is an interesting one. Falls. You know, you elderly people take medication, they walk, they trip, they fall. What about young people? Well, young people, young adults taking 2 drugs or more have a 2.5-fold increase of falls. So it's interesting. We tell old people to watch out the way they walk, that they're going to fall. That young people, and the most common drugs, hypertension drugs, drugs to lower your blood pressure, and those to lower your cholesterol. So again, it's one of those things that we used to tell people in the elderly. You also now have increased risk of falls in young people. Interesting?
Very.
Okay. Now, tonight's, oh, one other thing I thought that was interesting. Babies, when they talk, they can lip read. They actually learn to talk by reading your lips. It's kind of interesting. You think that they would imitate the sound, but they must have that component. And it usually takes in at about 6 months, they start looking at the parents' lips to see. And it really gets messed up if you're bilingual. If you've got two languages, it's very confusing. And the baby usually learns one at about 6 months and then the other one at 12 months. Again, the lip reading is very important. It takes into account, what if the baby's blind, you know, or can't see? Or the parents don't give enough attention to the child, don't give enough face time. The baby may be delayed in development in speaking. So again, babies are reading the lips. You want to look at them when you talk.
You were bilingual when you were
Almost.
I was bilingual.
Yes. You were bilingual?
Yeah.
What other? Oh, Italian?
English and Italian, yeah.
Excellent. Was that, it's tricky, but I guess you learn it as a kid. It shows the capacity the kids have. You try and do it as an adult, it's impossible. All right, now, what about our quiz for today? Now, we had a little bit of controversy actually in the quiz today because we had a quiz and the answer wasn't quite set. It had to do with villains and the color of the hair. I don't know if anybody out there knows it. It's not the quiz answer, but the quiz answer is kind of straightforward. What are the name of the 3 kings? So if you can come up with the name of the 3 kings, you're going to be a proud winner of the Ask the Doctor document in the plaque. Okay, so get your fingers. Now, baby picture. What about baby pictures here? Talking about babies, this last 3 weeks I was blessed with another grandchild. I have one already, Nevin, and now this is the second one, Samuel Hudson Stevens. Is that a distinguished? Look at him, a future Supreme Court justice. It looks like Samuel Hudson Stevens. I like the name a lot.
It's a great name.
Yeah, the name is amazing.
And they're my daughter, Hope Garner, and my son-in-law, Danny Stevens, who's no stranger to the show. Is lap band surgery and the bypass surgery, and Hope is an ophthalmologist. So we hope.
Very nice.
Thanks a lot, and thanks for showing that. Now, the number to call. Let's get down to business here. The number to call is 718-499-6101. Tonight's topics are geriatrics, emergency medicine, and rheumatology. Remember, you can also email us the questions to askthetoctor@netny.net. We have a lot of surprises. Don't go away. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor. I almost neglected to say Monsignor Bennett there for only missed one show in all these years. Monsignor, what do you think of the quiz? All right, he thinks it's an easy quiz. The 3 kings. Who are the 3 kings? That's that. And now let's meet our 3 doctors here. Number 1, Dr. Marguerite Katsina, who's no stranger. How many? It must be about 10 times on the show.
I would say so, about 10 times.
And what's new? We always like to know what's new in geriatrics. Anything?
There is a couple of new interesting things. One is For instance, nicotine patch has been shown promise in treating mild cognitive impairment, which is, it's a condition that people develop. They develop some forgetfulness, but to the point, it's not that extreme that it will affect the daily life. So far, and people who use the nicotine patch have been shown that the memory actually got a little better. So far, there is no recommendations and no exact dose for us to use it, but at least it's something new that we can hopefully will be useful in the future. Secondly, there is the number of studies came around that I find very important. A lot of patients taken different multivitamin supplements, and it's been very popular, and sometimes people forget to take the medications, but they never forget to take their vitamins and supplements. So the number of studies actually shown then people taking vitamins and supplements, particularly iron, actually die more frequently. The mortality is increased, so they die more frequently. What is it related to? It's not entirely clear, and definitely more studies are needed to be done. But in order for you to take the vitamins, you have to have a very good reason for that. So just make sure that you'll speak to your doctor, bring all your vitamins and supplements, and
good stuff.
This is,
Good stuff. Nice to hear. We're getting some calls coming in too. We're going to get to the calls in a minute. I want to get to Dr. Gatton, who's on a beautiful trip next week.
Going to Hawaii. I'm very excited about it. But I wanted to say something about the earphones, if that's okay. Because I consider people walking around with earphones job security, that they're going to end up in my emergency department. And that's not really what we want. So some of the recommendations are to only keep one ear in or to keep the volume down so that you can still hear the ambient noise around you. And at home is a good time to use the kind that really block out the outside noise. But when you're on the street, you really need to be able to hear it.
Yeah, it's a good point, good point. And you went hiking yesterday, right?
Went hiking, it was 13 degrees, very different from next week when it'll be 80 degrees in
How far
Hawaii.
did you go?
We hiked about 4 hours. I'm not sure how many miles.
Amazing, amazing. Multi-talented, and we're looking forward to the questions coming in. Dr. Morano, how are you doing today?
Good, great, thank you.
Now, you're in Chicago, I think we've spread, our audience is in Chicago tonight?
Yes, I have daughters graduating medical school there.
Wow, fantastic.
Thank you very much, thank you. I try to encourage her, we're proud of her. My boys think I favor her. Well, maybe sometimes I do.
So she's watching this from her house in Chicago?
I hope so. You know, I hope my boys and my
What's her name?
Jacqueline.
So Jacqueline? Great
Love
to
you,
see.
honey.
And well, it must be cold out there in the Windy City
Oh, they
tonight.
had snow. They had snow.
But anyway, it's great to see. We love having your father on. He's one of my
Thank
favorite
you.
guests.
Love you
Thanks.
guys.
And now we're going to talk to Patricia. Patricia, our first call of the night.
Thank you, Dr. Garner. Good evening. How are you?
Okay, how are you tonight?
I'm hanging in here. A little under the weather, but other than that,
I know
thank God.
it's going around. Something's going around here where people are coughing a lot, like a little bronchitis, a little fever.
Yes,
Does that sound
yes,
familiar?
Thank God.
Yeah.
Yes,
But,
thank God I'm okay.
Anyway, we'll try and keep you warm. What's your question?
Well, I have the answer to the brain teaser.
Oh, okay. Which one? The Three Kings?
The Three Kings.
The Three Kings. Okay, we need it exactly, so take your time and say it correctly.
Thank you very much. The first king is Balthazar.
Okay.
The second is Gaspar.
Okay.
And the third is Melchior.
Judges, can I have a ruling? I can't believe Patricia just knocked that quiz off. You just got that one right on the head.
Thank God.
Have you won before?
No, I have never won.
Okay, this is great. So where's the plaque going to go?
It's, well, I have to find a distinguished place for it, possibly in my dining room.
Oh, beautiful, beautiful. How many years have you been watching the show?
I've been watching, this is your 16th season.
Yes?
So, yes, I've been watching all along.
Wow, an original guest as we grow old together. Very good,
Yes,
very good.
Indeed.
But
Yes,
where are you
indeed.
calling us from? What neighborhood?
I'm calling you from Queens Village, New York.
Queens Village. You got such a great voice. This sounds like you should be on. We may have to have you on as like an announcer here.
You're very sweet. I would very much enjoy that, indeed. I happen to know of Dr. Placido Morano because I happen to have RA, I have OA, and osteoporosis, and one of his colleagues, Dr. Harry Bienenstock, is treating me very effectively.
He trained me, actually.
Wasn't he the guy in the producers? Who was that Bienenstock? No, okay.
No, he wasn't.
So tell us a little bit about OA and RA.
Oh,
Well,
you could tell us.
no, go ahead, doctor. Sorry, please go ahead.
Well, osteoarthritis is the wear and tear arthritis. As we get older, 100% of people will get osteoarthritis, especially over age 70. Everyone has OA. But it develops at different rates in different people. Genetic factors as well as stresses to the joint where the cartilage deteriorates, and it leads to increased pressures leading to narrowing of the joint as well as dysfunction of the joint. And so that happens with time. And joints that are involved are the knees, hips are involved, the spine is involved, hands involved. Osteoporosis, some people confuse osteoporosis with osteoarthritis. Osteoporosis is a decrease in calcification of bone, where the bone gets brittle and it could break. And so where osteoarthritis gives you pain where bones meet, which is a joint, osteoporosis does not give you pain other than the fact that if you do a fracture, you can get pain that way.
Interesting. Patricia, thanks a lot. I hope you enjoyed the plaque. It should be there shortly.
Thank you
Say
so
hello to
much.
Harry.
Take
Bye-bye.
care. Be
I
well.
certainly will, and have a pleasant evening.
You too, thanks. We're going to go, hey Frank, how you doing?
Oh, I'm okay, thanks.
How you call, where you calling us from?
Brooklyn.
Which
New
part?
York.
Brooklyn, New York. Which part?
Oh, Crown Heights.
Crown Heights. You've called the show before, haven't you?
This is my first time.
Okay.
Because I just found out about it 3 years ago.
And so let me ask you a question, Frank. You know, 40 years ago today, a very famous song came out. A lot of people try to make that the day the music died, you know, that there was a plane crash with Buddy Holly and...
Oh, I remember that song, yes.
What's the name of that song? 40 years ago today.
40 years. Its name, American Pie?
Yeah, America. Isn't that amazing? 40 years went by since we heard that song. And you know what? I heard Don McLean, who sings the song, said that people made up all these things and it wasn't really meant to be anything that particular. You know, he just wrote a song because it sounded good. But everybody still to this day tries to make sense out of it.
Yeah, I've heard about it. I've heard people from all over, even Japan, talk about it. They say, I'm not sure what it meant.
What it meant.
I love it.
Drove my Chevy to the levee. You know, who knows what that means? But
Yes.
I levee all the time.
But anyway, so Frank, what can we do for you tonight? See, I got you. He's doing American Pie, and I forgot.
No, I've been having headaches for about 3 years now, constantly.
Where is the pain?
In my head.
So headaches for 3 years.
Yeah. You see, I was treated for prostate cancer, very small prostate cancer.
Okay, how old are you?
I'm 63.
63. So 63 years old, was treated for early prostate cancer.
Very early prostate cancer. It was no more than a dot.
So let me see, Doctor. Let me just ask Dr. Gann. He walks into your emergency room, right? He says, "I got a headache for 3 years." What kind of things go through your mind?
Well, first I want to know who he's seen about it and what tests he's already had. If it's been going on 3 years, have there been any changes to it? Is it worse when he wakes up? Has he had any?
Mostly, yes. Mostly when I wake up, it's really crushing. I just cry out each time I wake up.
Terrible.
Have you seen a neurologist?
Yes, I did. And he changed the medication, but he never gave me a test yet.
A CAT scan. And
CAT scan. Well, I took the CAT scan, yes, but not by the neurologist. I took one CAT scan and 2 MRIs, and nothing shows.
Okay, so that's good news, even though it's frustrating to not have an answer to where your headache is coming from.
Well, what happened? Well, I read a book and also on the internet that when seed implant is combined with radiation, it travels very slowly and hits the brain, so the nerve, and that's what I felt.
Dr. Kutsina?
That's just what I felt.
Yeah, this is, Frank, I would say that this is very unusual for the prostate seed travel from the prostate to the brain. And, but there is a couple of other things that can cause your headache, crushing headaches. For instance, it could be the migraine. There is something that is called what is the trigger? The headaches.
Trigger point, yeah.
No, it's the headaches, cluster headaches, that are very, very severe and extremely uncomfortable. But those are usually the diagnosis of exclusion. So there is also, what I would advise you to do is just go back to the neurologist, because if your pain is so severe and nothing is helping, so there is something is going on, and definitely you need to be helped.
I'm wondering if there was anything I can do to extract the radiation from the system. Does that sound sensible?
Not really.
No.
I never heard of anything of the.
Frank, it's not from that, even though you may think so.
Even though it seems like it started at the same time.
Let's be frank.
It's
Because
He has to see the neurologist, and the neurologist has to put it.
if one medicine doesn't work, you just have to try another one. Sometimes headaches is just trial and error.
my doctor and he had a little grudge against me because of something I said about a certain medication. So he had a grudge against me.
No,
I don't think so. And Frank, there is also headache
Frank, if you have a
specialist.
problem with your doctor, you always could change your doctor. That's very easy. But you should definitely go see the neurologist and get advised by him.
Yeah.
Neurologist,
Good
and there
luck,
is
Frank.
also a headache specialist.
Good news, though. It sounds like you've been there for 3 years, nothing serious found. That's good news. But hopefully go to another neurologist, all right? Take care, Frank. Good to talk to you. Now we have Annette who's waiting patiently. Hi, Annette.
Hi.
How are you?
Good. Who's this?
This is Dr. Go. Who are you expecting here?
Oh, hi. How are you, doctor?
Are you ready to come on the air?
I sure am.
What do you think you're going to talk about?
I'm going to talk about my 58-year-old husband with a lot of lower back pain, neuropathy, diabetes, and all his problems with walking and standing up from a chair.
All right. I'm going to put you on in a minute.
Okay, thank you.
All right. We could talk a little bit now. No,
Okay.
All right. We're on, Annette.
Okay.
How are you?
I'm good, thank you.
I understand you have a problem with the husband who's 58 years old with back pain?
Yes, he's been having a lot of back pain. I'll give you a short synopsis of his history. He has diabetes, he has neuropathy, lower back pain, he also has irritable bowel syndrome and bipolar. So he's on quite a bit of medication, but recently his lower back pain has really worsened.
Let me ask Dr. Morano to jump in here.
Okay, great.
Anyway, the thing is, it sounds like he's uncomfortable, and he has
He's
a lot.
so uncomfortable, yes.
See, back pain, in that case, where you have comorbidities such as diabetes and depression, there's a lot of things that could cause back pain. Most back pain is, wear and tear.
Right.
Most people will have back pain. But once you add diabetes there, you could have discitis. You could, God forbid, get an infection. You could get...
They have mentioned some bulging discs that they've seen on an MRI.
Right. Well, a bulging disc can mean something or cannot mean something. Most of the population is walking around with bulging discs.
Right.
If he has a peripheral neuropathy,
Right.
is it a peripheral neuropathy or is it a radiculopathy where you're compressing one of the nerves coming out of your spine? He also has bipolar. So
Right.
people with bipolar and depression, they have a higher incidence also of fibromyalgia, which can give you
yes,
chronic low...
they have mentioned fibromyalgia also.
Oh, so he has fibromyalgia as well, which
Yeah.
exacerbates any pain that you do have from osteoarthritis or wear and tear. So it sounds complicated, and it sounds like he might need what they call a chronic pain management doctor.
Okay, he's going to see them. He does have a pain management doctor, and they have recommended shots. He's had them on several occasions, but they give him only temporary relief for like a week or 2 or 3.
But if they're giving him shots, they must have done MRI, and they must have seen what's going on.
Yes, they did. Yes.
So there's a number of ways of treating it, but again, they have medications as well as injections.
Right.
Good luck with
Very
this.
good. A lot going on, but it sounds like it's going to be, you can make them better. Okay?
All right, I hope so. Thank you.
Take care. We're now going to go to our email question. We have an email from Ohio. This show is spreading out here from Galena, from Adam in Galena, Ohio. Anybody know where Galena is? I'm not sure. Okay, his name is Adam, and he's in the 5th grade. Wondering how people, adults and kids, can improve their bone structure without harmful drugs. Who wants to
He's
think?
exactly the right age to say that. The best way to protect your bones when you get older is to maximize your bone health when you're young, to lay down more bone. So this is the time to drink lots of milk, you have lots of dairy, make sure you have a calcium-rich diet, and do lots of exercise. And that way, if you do this while you're still young, before your bones are done growing, then that's the best thing you can do to protect yourself when you're older.
Very good. Thanks a lot, Adam. We appreciate the call, and keep watching the show. Okay, before we get to Rosa asking about restaurants, we're going to go to Ivan. Hi, Ivan. Ivan?
Hi,
Ivan?
how are you?
How are you doing?
Happy New Year. Hi, Dr. Morano.
Hey, how you doing?
How you doing?
Okay.
Happy New Year to you. How long can you say? We always wonder about that. How long is it appropriate?
31st.
31st of January. Okay, so Happy New Year to you. What did you do New Year's Eve? Ivan?
Yes.
What did you do New Year's Eve?
What did I stayed home, and I didn't watch the ball drop. I figured I'd go to sleep and see it the next day.
Smart man.
Very good,
Smart.
very good. Which part of Brooklyn?
Midwood.
Oh, not far from here. Very good.
Okay. What happened was there was a person on your panel before about headaches, and I just had an episode with headaches, pounding in the head, in the upper, on the upper forehead and around the skull. I went to the neurologist, and they did the MRI. They did the blood test. Everything came out normal. I took a VNG test, which came out a little bit abnormal. So I went to a very good doctor in Brooklyn Hospital. He's a ENT doctor, and he knew in 1 minute by looking at me that I have labyrinthitis.
Very good.
Now, I never had that before, but it's unbelievable pain in the head that doesn't stop. He said it's going to take at least 6 weeks before it goes away. There is no treatment. But the thing is that I take Tylenol because I can't take anything else. I have irritable bowel syndrome. I can't take the NSAIDs. Is there anything else that you know that might relieve some of that head pain that won't kill my stomach?
Dr. Katsina?
I know that you mentioned that you're taking Tylenol, right? You'll have to make sure that you will not exceed at least 3 grams total of Tylenol. 3 grams total a day of a Tylenol.
How many pills is that?
So if you're taking, what are you taking, 500 Tylenol?
I take 500, the 2 pills 2-3 times a day.
Okay, so you're getting about that amount. So it's 2 tablets of 500 every 8 hours, and it will give you 3,000 milligrams of Tylenol. Now, if you have irritable bowel syndrome, that definitely you should be avoiding NSAIDs.
NSAIDs, right?
Yes. And now there is some stronger medications that help with the headache, and I would still believe that if your headache is that severe that Tylenol does not help you, you should go back to the ENT doctor and have him take a look and see what it is that's happening, because the labyrinthitis may not always give you the headache of that severity. So it's possibly maybe there is some sinusitis, maybe there is something else. But just please follow up with the ENT doctor.
Thanks, Ivan.
What is really labyrinthitis?
It's an inflammation of the part of the inner ear, and most common presenting symptom with labyrinthitis is a dizziness, a vertigo, or maybe you may have some sound in the ear.
Okay, but I have a bad cold on top of it. Could that be giving me the headache?
Yes, absolutely.
So that's
there
what
is also absolutely so the decongestant. Yes, but you'll have to be very careful with the decongestant, because there is in people who have high blood pressure, the decongestant can elevate the blood pressure even more so. So you'll have to be very, very careful. So that's why, very importantly, follow up with the doctor, follow up with the ENT doctor, and see what else is happening there.
Thanks a lot, Ivan. Appreciate it. We're going to take a break, but first I want to read this other email from Rosa. Hi, doctor. I deal with a lot of restaurants in Brooklyn, and the fact that you mentioned 23 Supper Club is amazing. You know of it since they have just recently opened. I know of Queen Restaurant, and they are always highly rated, and I've eaten here. The food is incredible. That's downtown Brooklyn. Absolutely loves it. Made with fresh mozzarella, fior di latte, which is the cream of milk, And she's saying you should go to La Sorrentina, which I've gone to many times. That's on 11th Avenue and 66th Street in Brooklyn. Casual place with huge plates, old world ambiance. And I should speak to Joe or Johnny, and they did take care of me, Joe and Johnny. No, we got a tremendous review here. If you like steaks, she likes the living room steakhouse.
Yeah,
Anybody
we have to get a printout.
Where's this now? We'll see. Maybe we're going to find it out. Rich and opulent ambience with great description with really good steaks. You should speak to Seo. If you need any other information, please contact me anytime, and I'll gladly answer. I want to thank you for being such a wonderful human being, for being so patient with all the answering questions. God bless you and your family. Happy and healthy New Year. It's beautiful, Rosa. Thanks a lot. Mama Rosa, excellent restaurant. Anybody eating there? Mama Rosa, sort of a little bit like, what's that, the place for pizza?
Mama Teresa?
No, it's on 13th Avenue.
Mamma Mia?
Or maybe on 5th Avenue. Gino's. A little bit like Gino's, Mama Rosa, but a little bit, I think it might be a little bit better cooking even. So.
What was that Mama something in Times Square, remember?
Oh, Mama Leone,
Leone,
another great place. Anyway, let's move on. Tonight's number is 718-499-6101, and our topics are geriatrics, emergency medicine, rheumatology. We're going to get right back to your phone calls, so don't go far. See you soon.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, where our topics are geriatric medicine, rheumatology, and emergency medicine. Now let's get to more questions right away. We'll go to Angel on line 2. Hi, Angel. Angel, how are you doing tonight?
How you doing, guys?
We're doing well. Where are you calling us from?
Coney Island.
Coney Island. What's going on? You know, I hear the Brooklyn accent is going, they say it's disappearing. That's a sad thing.
No way.
We got to do our best to preserve that. What better accent would anybody rather have than a Brooklyn accent? Right, Angel?
Well, yeah, I guess so, but I got a Puerto Rican accent.
I hear it a little bit of Puerto Rican in there too. Puerto Rican, Brooklyn, yeah, a little Bronx, everything you got in there.
Yeah, I'm all mixed up.
Welcome. You're out in Coney Island.
Right.
So you ever go out there to that place? What's that nice?
Luna Park?
No, the restaurant out there.
Spumoni Gardens?
Not Spumoni Gardens. The one in Coney Island. You know, they used to have an octopus on the ceiling. It begins with a G.
Not Giulio. I'm thinking about the...
Gargiulio.
Gargiulio, yes.
Yeah, I don't like what they did to Coney Island. They're taking the rides out, the old honky-tonk feel of it, trying to make it too sterile. What's this, like Disneyland?
Yeah, they turn everything down, you know, and just...
Terrible.
Sad,
I think he doesn't have a sense of feel for this area. I hate to be controversial here, but... We ever been on the cyclone?
Yes, when I was younger. I can't do that now because I had 2 back surgeries.
Have you been on it?
He had two back surgeries.
2 back surgeries,
yeah, he didn't go on there.
So Angel, well, anyway, so Spumoni Garden's the best, right? You go there on a summer's night.
It's best. I think it is best.
Nothing's better. Sit outdoors and enjoy that Spumoni.
Yeah, but I can't even eat that anymore. So
why?
I had a couple of strokes a few months ago.
How old are you?
52.
Oh, that's so young. So young.
Yes.
My
concern is because I had a stroke on December 1st, right?
Yes.
And I got treated at Coney Island Hospital, and I got discharged without any kind of type of medication, no blood thinners, nothing like that. A week later, I had another episode where I was driving. I went to Maimonides. They did the CT scan, MRIs, and they found a blood clot in the right side of my head. Ooh. So they put me on blood thinners, Plavix, and baby aspirins, and Lipitor for the cholesterol. So Friday, on the 13th, I went and I checked into emergency because I was having a headache. They did a CT scan with the dye, and they did a couple of CT scans and an MRI, and they found out that I might have a little bit of bleeding. So my doctor tells me, the radiologist said it might be bleeding. The doctor told me, the stroke doctor and the neurologist says it might not be bleeding. So anyway, I was there until today. I got discharged today. They sent me for an angiogram through the groin.
Okay.
And my concern is, should I be concerned if it is bleeding? Because I don't think they being straightforward. Because if I don't have any bleeding, why are you sending me for the...
Can I just ask you, do you have any weakness in your arms or legs?
Well, I do, but that's from the first surgery in '98. I had back surgery. I had a cyst in my spine, and I had some fluid buildup in my spine, which was removed. So the weakness comes from that. Now, I can't tell. I mean, it is a little weaker now than it was before because of the stroke, but...
Let's see what Dr. Gatton would do if you came into her emergency department.
Well, the good news is if some people look at the study and they think there's some blood there, and other people look and they're not so sure that there is blood there, then it's a small amount. And that's why they discharged you to go have some other studies, because it's you can't, you know, like you said, the weakness is kind of what you've had from your last stroke, and so you need some more tests, but it's not what we call catastrophic, where it's, you know, eminently life-threatening. And so I think you need to have the test to clarify what they're seeing, but I think you should be reassured that if it's, some people think it's there and some people think it's not, that it may be a small area, and you should be reassured about that.
So we think it's the right move, going for the test, get it done. Will you give us a follow-up next week?
Well, yes, but another thing is that that Friday they did 2 CT scans and an MRI, and one of the CT scans was with a dye.
Right.
Now, the first time I had the stroke with the friend first, they also put the dye, they injected the dye on me. Now, if that dye, does that do any damage to the liver?
No, the dye usually may damage the kidney. So before you do the angiogram, please make sure or just speak to your doctor that you'll have the blood test done and your kidney function is checked. Because the dye can affect the kidney, it can cause an allergic reaction, but it's less likely so because you already had the dye.
And Angel, you should drink a lot of fluids, even at this point. It's a good idea. Drink a lot of, what do you like to drink? Soda, water, whatever you like, just drink that.
Oh, yes, because I mean, I can't stand water. I will have to put a little bit of lime to give it a little
what you got to do.
Yeah, just drink a lot of fluids and please make sure that your kidney function is checked.
Angel, I want you to call us next week, please. Okay?
I will do that.
Take care. Good to hear. You got a bad fortune, 52 years old. So young. Hi, Maria.
Hi, doctor. Thank you for taking my call.
How are you? Beautiful voice again.
Thank you.
Have you called before?
I had called about a year ago, and I had spoken to the doctor there concerning a lung problem that I had.
Uh-huh.
And the problem, I don't know if anybody on the panel there could help me, but I've become a very complicated case, and I have a non-calcified lung nodules with a COPD. And now I've recently developed a blood problem also.
Which blood problem have you developed?
Well, they're watching me for, I believe, a myeloma.
Okay, so let me just get this straight. You're a smoker?
No. I stopped smoking 35 years ago.
And now you developed a small nodule in the lung.
I have 3 non-calcified lung nodules and cylindrical bronchiectasis. So I'm a very complicated case, I was told.
Are these lung nodules stable? They're not changing?
They have been stable, but I've been told that you can have these nodules for a very long time, and they could grow slowly or not grow at all, and then just start to grow.
So what was the rationale for watching it? What did they feel?
They have felt that they would give me CAT scans every 6 months.
Sounds reasonable.
Right, but the issue is the question. I'm in a lot of body pain, and they gave me Tylenol and biphosphonate permethrinate.
Okay.
And I was told that that will strengthen the bones, and also that also did help with the pain, but they said it would strengthen the bones and also help with any metastasis. So the problem seems to be that I'm a very complicated young woman.
How old are you?
56.
Right.
And
so
I'm trying to get help, and I just don't know where to go. I feel like I'm just in the middle of the ocean without any oars.
Well, we got 2 issues to address. The lung nodule that's stable.
Yes.
And the myeloma, which sounds to be limited. It doesn't seem like it's all over the body, right? It's a few areas?
But it's not
so far, to be honest with you, they gave me a PET scan that didn't show anything except some of the radio tracer went to a spot in my T4, T3 area of my back.
Okay. All right, who wants to start?
So I can start with the, the myeloma, right? Apparently is, so when did you have the PET scan?
I had a PET scan, I had a bone scan actually The bone scan was in April.
And a PET scan?
A year ago.
And a PET scan. And now you've been, I assume that you've been seeing the oncologist or the hematologist,
I
right?
go to a hematologist. Yes, I do in Manhattan, a very prominent hematologist. And he will not actually diagnose me because he said he kind of took me under his wing and he said he had sent me to pulmonology. And I think I'm kind of stuck in pulmonology because I think that these nodules are not, they won't biopsy them because they're very small right now. And I've been to a doctor, and he said, well, I went to a surgeon. He said, well, we could take them out, a wedge operation. And then my doctor says, don't do that because you could lose lung function, lung function.
There are some new ways.
How is he going to take 3 nodules out? So I'm just so complicated, and I'm just not getting any help, and I just feel like, I don't know, I feel like, we're in this country here, and we have so much wonderful medications and everything, and can anything be done for me? Can I go someplace or?
Maria,
yes.
Now, have you actually been diagnosed with the multiple myeloma?
No. He's just told me he's watching.
I see. So
my white blood count actually has been as high as 16,000, and it'll go down to 8. Then it'll go back up to 12. Then it's all over, it's up and down. And also my platelets have dropped to 100. But then yet they go back up too. So I'm fighting whatever this is. I'm still fighting it.
It's a very complicated,
it's very complicated,
it is
doctor.
very complicated. It's still unclear. It's very unclear what actually is happening. Because if you do have myeloma and you have lesions in your spine, there is some, chemotherapy that can be given. And apparently, this is one of the reasons that you've been getting the medication intravenously to improve your bones.
There are new ways to biopsy these and to take them out without disabling you.
The lung nodules?
Yeah, actually, we're having in a week or two, we're having a Dr. Lazara who does these procedures.
Really?
It's maybe a good idea to let him take a look at it.
Okay.
So why don't you give us a call next week? We'll take a look at the studies and try and figure out what's going on.
Okay. Now, who can I get in contact with to check out these nodules? Because these nodules are millimeter size.
I'm going to give you the name, Dr. Richard Lazara.
Okay.
Okay, give a call over to the Methodist Hospital tomorrow.
Okay.
And tell him you were on the you know he's going to be on the show, that you have this problem, you were wondering if he could see you.
Okay, do they take them out with this wedge operation?
No, it's different. It's a little different.
It's different?
Yes.
Even if they're millimeter size?
Yes.
Wonderful.
Okay.
Okay, I will call. Okay, I called Dr. Lazaro and tell him I was on the show and he can speak to me.
Yes.
Wonderful.
Thanks.
Thank
Take
you.
Care. Dr. Morano, anything you want to throw in this back pain, and could it think about maybe?
Well, if you have multiple myeloma, that's a cause of
definitely some multiple myeloma should be addressed, and it's maybe see another hematology oncologist to get an answer.
That's one of these cases where it sounds like I mean, we try and help you go in the right direction. Obviously, it's a complicated case, but the woman had a lot of questions that were unanswered. So hopefully you check out our advice.
I agree with Dr. Kotsina that the multiple myeloma is more concerning really than the small stable lung nodules.
Yes.
So I think following up with the hematologist is much more important.
It's very important, right? Yeah. Because it's kind of like a half treatment, right? The intravenous medication for myeloma, but there is no chemotherapy. So there is something, you need to go back to the hematologist, oncologist. Very important.
I hope we get a follow-up, and hopefully we can bring the audience up to date and find out what happened. Okay, we're going now to Marie. Hi, Marie.
Hi, how are you?
How are you? You're waiting patiently for us.
Oh, thank you. I have a quick question. I'm 62 years old, and I suffer from hemorrhoids of all things, and they're quite severe. And I've had several colonoscopies, and every time they come up, because I have the bleeding, every time it comes up as hemorrhoids, and the bleeding just continues to get worse and worse. I've gotten to a point where every day I'm using suppositories, and I'm just a little concerned about the long-range, if there are long-range bad effects to using suppositories.
How old are you, Marie?
62.
62. You're losing a lot of blood?
I do lose a lot. Well, it seems like a lot. I very rarely have bowel movements where I don't bleed. So it's quite messy. Sometimes it's more messy.
You're taking a stool softener?
I take a stool softener and I take some Metamucil, but I don't do it every day, because the other problem I have is that I guess I don't know if it's irritable bowel, but there are where I have frequent bowel movements, and when I go a lot, it makes the hemorrhoids worse.
Okay,
That's
anybody who wants to jump in and take this hemorrhoid question?
Well,
I'm a rheumatologist.
So
I'd be happy to.
That's why he went into rheumatology.
The first thing, are you getting Epsom salt baths? Are you doing sitz baths?
No, I don't take baths. I don't like baths. I don't take baths. That's the problem.
You can get something that actually fits into the toilet that kind of will sink your bottom into a bath rather than having to actually sit down into a bathtub. And you can put some Epsom salt and warm water in that. And that's actually much more helpful than doing suppositories all the time. Drinking lots of water is also very, very important. You can see a surgeon and they may or may not choose to take them out, but really they're going to want to see that you've tried many other things before you go that route, because it's a long recovery.
Hope that helps, but again, you want to check your blood count, make sure you're not losing too much.
And see your doctor.
Okay, Marie?
Okay. All right. Thank you very much.
Be well. Thank you. We got Frank in Brooklyn. He wants us to explain what macular degeneration is, the symptoms, and is there a way to prevent it? And
it's just in general. It's more common in somebody who is older, about 65. There is two types: dry and wet macular degeneration. And what actually happens that the tissue of the retina is changed, and it becomes like a scar tissue, so to speak. So the most common presenting symptom is could be some vision loss, or maybe some floaters, or some just something is wrong with the vision. Anytime you feel if you develop any symptoms that affect your vision, you'll have to see the eye doctor. There is no way to prevent it. But however, the good news is that there is some new promising medications, injections that the ophthalmologists use successfully to improve the vision in somebody with a macular degeneration.
excellent. Thanks a lot. We're going to take a short break to pay some bills here. And when we come back, we're going to get right back to your questions with the topics of geriatrics, emergency medicine, rheumatology. Don't go far because we got a lot of calls pending. See you soon.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, where we have geriatrics, emergency medicine, and rheumatology, and we have busy boards, busy emails. I don't even know which direction to go in first. So why don't we take Mandy first, and then we're going to go to an email question. Hi, Mandy.
Oh, hi.
How are you doing?
Okay, who's this?
This is Dr. Steve Garner. How are you?
Okay.
Is that the right number?
Yes, sure.
Very good. What can I do for you?
I used to be a patient of Dr. Morano. I think you remember me, Mindy, the one who made him nervous with the blonde hair? Ask if he remembers me.
I always thought you were a nice person.
Yeah.
What's up?
No, I have severe osteoporosis, but I had a DEXA test in January, and the doctor said that it did improve from the shots that I was taking from Dr. Morano.
Excellent.
Very good.
Another success.
I'm not on it anymore. I'm just on vitamin D and calcium, but I want to know if there are any new drugs out for osteoporosis.
There are.
There are?
There are.
Which ones, please?
Oh, you want me to tell you?
Please, I would appreciate
Where
it.
you been, Mindy?
Yes, please.
Where have you been, Mindy?
Oh, I'm still at Colonial Hospital.
I know.
I miss you.
I know that song.
So basically, she's asking about osteoporosis and medications for it. There's two medications that I know that are pretty. One's new, Prolia, which is a rank ligand inhibitor, which is used for osteoporosis, and the other one is Forteo. Forteo's been around since 2001, and that is a medication that actually goes to bone and stimulates osteoblastic activity.
What's the one that's once a year? The shot, Relenza?
That's Reclast.
Reclast.
Reclast,
Does that work?
which is the same as? Zometa, right.
Dr. Morano, I was on Forteo. You had put me on that.
Right, and that's a good medication.
Yeah, they say you can't be on a woman for 2 years.
You only could use it for 24 months. But it does improve your bone density, And if you kept exercising, Mindy, the way I suggested, as well as take your calcium, vitamin D, you should be well.
Okay, Mindy,
so take care. I remember you, Mindy.
Vitamin D should I take? Vitamin D3.
Very good.
Excellent, excellent.
Thank you.
Now we're going to do a rapid fire segment. We're going to go around the room. Whoever gets the question gets the question. The first one, Audrey. Hi, Audrey.
Hello.
Welcome to the rapid fire segment.
Yes, hello.
Hi. So what's your question?
My question is that for the past 5 years, I've been having tight feelings in the back of my head. Then it travels to the top of my head. Then it travels to my face. It feels like a locked, tight pressure feeling.
Okay, we got it. Dr. Katsina,
So it
1
could
minute.
be a lot of things. It could be tension headache. You may have some problems with your neck. You may have elevated blood pressure. But again, you know, the recipe is the only see your doctor and have yourself checked.
Thank you. Donna, how are you?
Hi.
Hi, what's your rapid question?
My question is that I'm having pains and like burning on my back, both sides of my back, and I'm trying to figure out what causes it.
Okay, how old are you?
I'm 48.
Okay, Dr. Gatton.
I'm 48.
Okay, we're going to hear from Dr. Gatton. Why don't you listen to the answer?
So often there can be from a pinched nerve or a pulled muscle in your back or a disc that's slipped. So you need to see a doctor and have them examine you and decide if you need further tests to find out.
Thank you very much. We're so rapid with it, the guy can't even keep up with. There he goes. James. Hi, James. Hello?
Oh, there he goes.
Hello.
James. Hi, James.
Can you turn off the TV because you got a little bit of back.
Hello.
Okay, we've got to move on to that. Now we got a quick question. Actually, someone wants to know about being a doctor on the email question. And he's a college student, and he thinks he wants to become a doctor. He wants to pick our brains why we went into medicine, what we feel was rewarding about medicine. It's from Corbin. And he has some questions that he has to do for English. We're going to help him with his English homework. Okay, number one, Dr. Morano, what hardship did you have to overcome during your pursuit of your career? 30
mother-in-law.
seconds.
Next question.
Okay. We'll go back to Dr. Katsina. How much personal time is consumed while being in practice?
You have to make sure that you're available 24/7.
Dr. Gatton, what do you love about your job?
I love everything about my job. I get to see a lot of patients. I get to ease suffering. That's what we all went into this for.
Dr. Morano, what do you hate about your job?
Dealing with the insurance companies.
Oh, good one. Dr. Katsina, why become a doctor?
I think Dr. Gatton basically covered it all. We would like to help people, and there is nothing better, there is no feeling better when you feel the patient is getting better after you've taken care of them.
Dr. Gatton, what college did you graduate from?
I went to undergrad at CUNY, and I went to medical school at SUNY Stony Brook.
Dr. Morano, what was it like doing residency?
Difficult. We used to be on every third night, and you basically worked hours and hours and hours.
Terrible. Dr. Katsina, what advice can you give me on becoming a doctor?
You'll have to make sure that you really like the profession, that you're able to devote, you're willing to devote all your life, your personal life, a lot of time. And if you're willing to do that, that's definitely, this is a career for you.
And Doctor, finally, what's your greatest feat of being a doctor?
Oh, that's a longer story. But there's a lot of great feats, and it's absolutely worth doing, but you got to work hard.
Thanks a lot for the question, Corbin. I hope that helps you out. Lisa. Lisa. Lisa.
Hi, good evening. How are you?
How are you? Where are you calling us from?
Sheepshead Bay.
Sheepshead Bay. What can we do for you tonight?
I have a quick question. My mother has fibromyalgia,
okay,
and I just wanted to know, is this hereditary?
Yes, there is. Daughters and granddaughters can have fibromyalgia. It's more common in women. That's why I mentioned that. And yes, it is. Also, depression is also common. And so this might go from one family member to another family member. And I'm sorry she has fibromyalgia because she has chronic pain.
And Lisa, how is Lundy's, the site? Is it falling apart or are they keeping it up?
It doesn't look good.
That was such a shame to see that place go.
I know.
Good luck.
I loved it.
Used to be I appreciate it. Thank you so much.
Okay, have a great week, okay?
You too.
Call us in next week. Okay, I have a renal transplant question, but I'm not sure we're going to have time for that. It's a tricky one, but let's see what we can make out of it. He's had 3 transplants. This is from someone named Betsy at Downstate and Cornell beginning in 1981 when I was 15 years old. Only this year I was finally diagnosed with lupus. Got to go to Dr. Morano. Began seeing a new rheumatologist And he
special
had
surgery, yeah.
uric acid.
Linda Russell, very good rheumatologist. I suggest that you definitely follow up with her. There are multiple medications that are used. In fact, there's now an IV medication that's also used for lupus. So definitely listen to your rheumatologist. Good luck.
And I think that's it, right? That let me take it. I still got another question, but I can't. You know, next week, please call it in. But did I say this was going to be a great show? I mean, look at what a talented group here. I want to thank Dr. Marguerite Kutsina, Dr. Barbara Gatton, and Dr. Placido Morano for coming in. We hope we've been able to help you. Now remember, it's good to be proactive about your health. Speak to your doctors about your concerns. Go for second, third opinions. No doctor should fear that. Visit the website at netny.net/askthedoctor, or you can read the tablet, the column that we put in the tablet, and you can participate in the viewer survey and watch past episodes. I want to thank Dr. Linda Lapitosa, who's the quiz master, for her question, and all of you for your questions. Don't forget to tune in tonight at 10 o'clock for the encore presentation of last week's show. That was our first show of the season, so you're going to want to watch that if you missed it. For next week, we're going to discuss lung disease, cardiology, family medicine, and community medicine. I want to say goodbye to everyone. Stay healthy. See you in the tablet, and we'll see you next week at 8 o'clock. Take care. And what's yours? Give a shout out to?
Jackie, I love you.
Love you, Jackie. Take care. Bye.